A very good afternoon to all of you. Shri Sunil Manoharji, Shri Shailesh Joglekarji, Dr. Anand Pathak, Mr. Shashi Mandapati, Anand Aurangabadkar, all the dignitaries present here, all the dignitaries, doctors who have come from different part of world, and dear friends, as rightly explained by Shri Sunil Manoharji, the theme of this conference speaks for itself. Oncology beyond borders. All of us know that when it comes to any disease, any health challenge, any disorder, it doesn't understand any boundary. It doesn't recognize status of a person. It doesn't recognize the geography where they stay. And that is why in today's connected yet fractured world, it is our responsibility that we come together, we share the ideas, and we think beyond. This conference is something where we will be thinking beyond. All of us know that in the last decade, the incidence of cancer is rising at unimaginable speed. Unfortunately, a country like India, which has done very well in eradicating certain diseases, in fighting with infectious diseases, is now fighting with cancer. And cancer, as of now, has become the biggest challenge before the healthcare system of India. And this is not just happening in India, it is witnessed globally when United Nations gives statistics which says that the incidence of cancer may increase by 75% in next 15 to 20 years. The situation looks very scary. If I look at my state of Maharashtra, in past 5 years, this incidence has increased by more than 11%. And I think that's very alarming. Now is the time where we not just fight the disease, but as rightly said, we try to prevent it. The huge population, it is very important that we have ability and instruments to screen every suspected case, to have SOPs where we generate a suspected case and also have ability to treat it early. because early treatment is the key. And that is why I think that today, when one institution like NCI is created, it is not only helping patients from central India, but now patients from different countries are also coming here. Procedures like BMT are being performed here. All the new technologies are being brought here, experimented and extended to the patients. But we require many more. In the state of Maharashtra, we have created Maha Cancer Care Foundation, which is a Section 8 company of government. And this company is creating entire cancer grid in hub and spoke model, whereby every geography of this state and every person of this state will have access to cancer care. All of us know that one of the biggest challenge in cancer care is affordability. We have often seen people from marginalized sections of the society are the one most affected with cancer, and they often lose all their fortunes fighting with the disease. And this is one disease where not just the patient fights, but the entire family suffers. And that is why affordability is also something which we need to bring through our new treatment protocols. I'm very happy that the Government of India, under the able leadership of our Prime Minister, Shri Narendra Modi ji, has been constantly reducing taxes on imported cancer drugs, on the radiation machines and machinery, and it's trying to bring down the cost of cancer care to make it more affordable. We are in an era of technology. Today, medtech, biotech, and AI are revolutionizing the entire field of healthcare. They are not just bringing predictability, but they are also bringing affordability. They are trying to take solutions to scale. They are trying to bring efficiency in the healthcare scenario. I think in the space of cancer care, we require more innovation, more research, more medtech, biotech, and AI, at least to create the tools of early detection so that we fight the cancer at the very beginning. I'm sure with the research which is going on in institutions like NCI and various institutes like the Tata Cancer Institute, which is one of the India's apex institution, I'm very sure that will be able to find new solutions which will make the treatment affordable. Today, there are many startups in medtech which are using AI and creating models whereby with the minimum intervention we can formulate the initial protocols. And I think all such innovations shouldn't be limited to any single institution. All these innovations need to go beyond borders. World over, whatever happens in the space of cancer treatment should reach each and every country, because I think humanity knows no borders. And to be humane is to not let anyone suffer, irrespective of the borders. I'm sure that conference like this will have deliberations around the best practices that are happening around the world, across the world. We have just seen forging of an alliance whereby the two institutions are coming together to help the patients get best health care. I think this is the way forward, whereby we collaborate and fight together. I must congratulate NCI and everyone who has helped in organizing this conference. Would like to welcome and thank all those who have come from across the world and from different parts of the country. And I would also like to thank NCI for giving me this opportunity to participate in this conference. I wish you all the best. Thank you. Jai Hind.
Thank you, sir, for your valuable time. Thank you all for being a part of this ceremony. Thank you. We would like to continue with our next session. I would like to invite the session in charges, Dr. Ekta Gupta and Ms. Sandhya Modak, to take the session forward.